And my next speaker is Dr. Irfan Ullah. Dr. Irfan is the head of the cyclotron radiopharmacy division at NMOL. He has done his PhD from Germany, and the research topic was developing theranostic based biomolecules. He has served as a research project leader with the IAEA at national and regional levels. I invite Dr. Irfan Ullah please to join for his presentation on the real challenges in establishing Theranostic Center in the developing country. Dr. Irfan Ullah.
Bismillahirrahmanirrahim. Thank you, Dr. Asif Rafiq, for the nice introduction. My title of presentation is Real Challenges in Establishing a Theranostic Facility in a Developing Country like Pakistan. Okay. Because we have been from the process of establishing gallium and lutetium facility in 2016 with the support of IAEA national projects in Pakistan that is running since last 6 or 7 years very successfully. So for the audience who are not from the PAC, in MOL, Institute of Nuclear Medicine and Oncology, it is among one of the 20 nuclear medical centers of PAC. Our main functions are nuclear medicine and clinical services. We have a PET CT and cyclotrons to make FDG on daily basis. In nuclear medicines, we have the gamma cameras, SPECT CT, radioimmunoassay labs, clinical pathology, radiopharmacy. These are some nuclear medicine studies. As I mentioned, since last some years, recent additions are with the gallium and lutetium-based therapies. These are some typical nuclear medicine procedures we are doing at NMOL, like other NMO institutes in Pakistan. It is our cyclotron and radiopharmacy division at NMOL. Our cyclotron is equipped with fluorine-18, mainly workload is this, but we have also functionalized our C11 and N13 targets. And we have the heart cells and PET imaging chemistry modules. We inaugurated our Theranostics lab on 8th May 2017. It was the day when the regional trainer course by IAEA was also inaugurated at Lahore. So, the term Theranostics refers to imaging and treatment of cancer by using receptor-specific molecular radiopharmaceuticals. It has the potential to change the idea of cancer treatment. It is very efficient approach that allows you to treat what you see and see what you have treated. It has revolutionized the personal medicine in cancer treatment. In the last 10 years, Theranostics has emerged as an innovative approach to tailored disease management. In the coming years, the growth of Theranostics is projected to be significant. Nuclear medicine has been stable radiodiagnostics imaging specialty last few years. In 2022, nuclear medicine global market was valued at $7 billion. But according to Medris Intel, it is a team of international experts providing first-rate strategic intelligence in nuclear medicine, cyclotron, and proton therapy. According to their data, this slide shows there are numerous promising radiotherapeutics with substantial revenue prospects are poised to enter the market by 2028. You see, after 2022, when the lutetium PSNM 617 by the name lutetium Pluvicto by Novartis, it is commercialized in the market. There is a rapid growth in the production of radiopharmaceuticals, and there is a lot of interest seems to be arising in next 5 to 6 years. This is the Pluvicto lutetium that has got the FDA approval in 2022. But along with other factors, the cost of this radiopharmaceutical is $42,000. It is per dose, means just 200 millicurie. So, I will not go into much details. As you know, this is the comparison between the cancer cell and healthy cells. The idea is that on the cancer cells, there are a lot of receptors that bind with the variety of the peptides. These are the various pathways for the molecular imaging, but since our topic is concerned in theranostics, I will focus on the peptide chemistry only. So role of peptides are the molecules that are formed of amino acids by a peptide bond between amino group and carboxyl group. Just like on the C terminal, we have the amine group, and the other side is the carboxyl groups. Basically, these two groups play a pivotal role in the labeling with the chelators, as well as followed by the radio labeling. This is the basic setup that is required to make a theranostic facility. Often we have a query that what kind of equipment we should have in our center. This is a theranostic module by ITG. Then this is the automatic theranostic heart cell. It is very important to have, in a sense, that you are working in the beginning with about 400 millicurie of lutetium. That is a lot of dose, and after labeling you get just 200 or 220 millicurie. So in order to avoid the spread of radiation, and especially for the protection of workers, there should be an automatic theranostic module that can control the radiation. So as we established the facility, there were some challenges that we faced in the beginning: regulatory, logistical, and technical considerations. The design, construction, and subsequent operation of a theranostic service has to be guided by the fundamentals of radiation protection by the regulatory agencies. It is very important. Just an example, in Europe, the IAEA through International Basic Safety Standards, this is the set of guidelines that they are followed. Radionuclides and radiopharmaceuticals, commonly used theranostic pair is gallium and lutetium. In the US, copper-64 dotatate is commonly used in addition to gallium. However, yttrium-90 is also occasionally therapeutically used, especially with dotatate. Regarding radiation protection, shielding of syringes and vials, as well as waste and storage. Since lutetium has a half-life of about 7 days, so it is very important aspect for reducing external exposure among the staff, public, and the patients. Storage of radiopharmaceuticals. Since radiopharmaceuticals are the radioactive biomolecules, they must be stored in a safe, secure, and environmentally appropriate place to which only the licensee and appropriate staff may have access. In addition, provisions for the safe storage and custody of radioactive materials must be in place, including protection against theft, fire, and chemicals. Administration. Accurate quantification of the radioactivity administered to the patient is the first step of the radiopharmaceutical administration. A radionuclide calibrator is the basic key that can measure the activity and cross-calibrates other equipments. Radioactive waste. Storage for decay is essential for the clearance of radioactive waste containing short-lived radioactivity with a half-life of less than 100 days. Clearance means it is the removal of radioactive material from regulatory control provided that the radionuclide concentrations are below specific clearance levels. It is defined from every regulatory body to every release of patients. Prior to injection of a radioactive substance, radiation safety guidance should be given to the patient and family regarding rules of conduct to reduce the potential radiation exposure. ICRP publication 94 and IAEA guidelines, they provide a good background how to implement these administrations. Safety report with comment on the release of patients. For example, in lutetium PSNM and lutetium dotatate therapies, patients are typically treated with an activity of 7.4 gigabecs. It is almost universal worldwide, and the initial dose rate from the patient after injection is in order of 50 millisievert per hour at a distance of 1 meter. Integrated care. Success of a theranostic center highly depends on the level of integration within an oncological setup. Not surprisingly, currently most successful theranostic centers are embedded in strong cancer centers, focusing on neuroendocrine tumors and prostate cancers. Lessons learned. Based on our experience, the most important aspect in preparation for the likely surge in theranostics is to seek advice and experience from centers already actively involved in such treatments. Of the lessons learned, by far the most important is that careful preparation of the project. It is number one. Planning and arrangement of financial resources are the key to successful implementation, so that the appropriate equipment can be put in place from the very beginning. So, developing the effective marketing strategy. Since it is an expensive treatment, so Theranostic offers advanced personalized treatment options that can attract patients seeking innovative cancer care. To effectively communicate the benefits of these relatively new and complex services, institutions should develop targeted marketing campaigns that highlight the personalized nature and clinical efficacy of theranostic treatments. So now I will go on to some radionuclide examples that we have adopted in our center. Lutetium. It has 2 gamma radiations and 1 beta minus. The energy of 1 beta minus radiation is quite high, 497. That is the main, 78%. Although we have also 2 small peaks at 175 and 380 keV. Regarding the production, 2 routes, carrier added and non-carrier added. In case of carrier added, we have little bit quantity of also lutetium 177M. But in non-carrier added, which is by the ytterbium route, we don't have this. Similarly, from the cyclotron, we can also make by bombardment of neutrons on YB176, neutron goes out and we will have lutetium 177. So this is some common suppliers in the world that are providing the lutetium 177. You see most of them are providing the carrier added, and 2 or 3 are also working on the non-carrier added. Basically the difference is of the specific activity. So this is the QC criteria it is most likely the same as for FDG. We are focusing on the identity, purity, injectability and biological purity. So it is our case 1. We have shown, basically it is the case that we did in the beginning, and it was successful, by which we got the courage that we should continue these services in Pakistan. Not only continue, but we should also further strengthen them. So it is another case in NETs. It is a significant disease regression after 3 doses of lutetium dotatate. This is another example, lutetium PSNM. We have done it in mole. So this is an idea. We have compared the DOTA and NODAGA. Basically, these are the chelators. Idea is that this NODAGA is basically the LM3. It is a novel somatostatin receptor antagonist. The DOTA is DOTA-NAG, or that is the antagonist, but there is a difference between agonist and antagonist. And we have tried this with gallium, so that afterwards we could label it with lutetium, so that lutetium is retained for a longer time at the site of METs. So alpha emitters. Alpha, it is very ideal because it has 28 million electron volt energy. Still I have few minutes. Okay. So I bind up. It is approximately half-life is 10 days. I was just here. This is the slide really showing the good therapeutic efficacy with the actinium and the clinical impact of actinium that has already been shown. Here there are the methods of production. One is through generators, and the last one, this is very appealing, from cyclotron. It is very straightforward. You need just radium-226, bombard it with protons, 2 neutrons are going out, and we will get actinium-225. if there is cyclotron for the production of actinium, this is very straightforward approach rather than going to the generators or nuclear reactors. Copper, this is my last part. Copper we have done as under the trial of a IAEA CRP project. Copper 64 basically here. Copper 64 is very promising theranostic reagent because there is no need to label it with any other radionuclide, just copper chloride here. Just copper chloride, you can use it for doing a PET image scan, and it is on the other side, the copper 67, that is also ideal for the therapy. So these are some applications of copper chloride in CA prostate, in prostate cancer relapse, and in copper chloride imaging of brain tumors, especially in glioblastoma multiforme, GBM, and also in non-small cell lung cancer. So I should conclude now. Introducing theranostics by PRRT in Pakistan. Need to establish novel molecular pathways through tumor heterogeneity profiles and advanced molecular imaging, leading to targeted therapy. Need to further strengthen and spread these applications at national and regional levels. This is our group, and thank you very much for your kind attention.